Hello, this is Leanette from Olivet Nazarene. I've been asked by the district to put together a plan for intervention on behalf of our student population with behavior disorders. This will really be a plan to support students, parents, teachers, as well as support staff. Due to changing demographics and the transition of new students into the district, the need has arisen for a comprehensive program of identification, prevention, and intervention to address students at risk for behavior disorders. The following is my recommendation for implementing a three-tier intervention program based on clearly defined data collection, staff role assignments and procedures, academically focused interventions, professional development, and a focus on specific disorders in the school population, such as ADHD and depression. First, it's important to identify just what these behavior disorders are. Students with emotional or behavior disorders are students that typically have academic deficits as well. But these deficits are difficult to overcome for them, even with our traditional special education services or academic RTI interventions. Thus, intervention in the classroom for these behaviors and a district-wide approach is really a necessity. The disorder types that we're talking about here are antisocial behavior disorders. Those are students who have difficulty interacting with their peers and adults. Their behavior might include aggression or peer rejection, bullying, fighting, or even stealing. Emotional behavior disorders can range from ADHD and anxiety disorders to even schizophrenia, which we have seen in the district in the past. Defiant or disrespectful behavior disorders include a pattern of non-compliance or defiance of teacher directions, or even vindictiveness towards peers or teachers. Within the district, we have seen prevalence of risk factors. We have a high transfer and mobility rate. Transfer students in the district have been previously identified with behavior disorders. We also have other risk factors such as low academic achievement, lack of supportive home environment or corporal punishment. The existence of physical abuse or substance abuse in the home can also be a risk factor, as well as low socioeconomic status. Video game violence has also been shown to have a connection to behavior disorders, and there is a comorbidity with ADHD, meaning these disorders tend to coexist. Because of the high prevalence of these risk factors, it's really important that the district employ the most effective screening tools to identify students with behavior disorders. Systematic screening for behavior disorders should occur at grade 1 through 6 universally. This is for early intervention, which is really important. Student risk screening scales can be used to identify behaviors that teachers or faculty are observing, or even parents are observing, that predict the development of behavior disorders. Once these behaviors have been observed and identified, then a BASC-2 or a functional behavior assessment can be used. This would be for our students who we've already identified as needing intervention, and we're trying to target the specific intervention that they need. In addition to these tools, we're also going to be using teacher observations and classroom behavior data, using our discipline and office referrals. Proactive data collection is going to be really important for early identification of students who may be developing behavior disorders or may already have one. The most effective approach that we can take as a district is to be proactive, to have interventions that are based on classroom strategies, academically focused, and really a plan that emphasizes building positive behaviors. An important step in this plan is the creation of a district committee for intervention and support. This is a committee that would involve administrators, teachers, and support staff working with students, and where appropriate, bringing parents into the group and allowing them to be a part in the planning. Another important part of this plan is implementing evidence-based interventions. This means professional development to support our teachers who have already said they don't feel equipped to work with these behavior disorders in the classroom. It means professional learning communities where we're working together, not only to coach one another, but to collect and analyze the data that we have on students. Interventions for students are going to be across 3 tiers. Tier 1 is universal support for all students. This is the teaching and practicing of clear expectations and positive behaviors. So a PBIS framework is going to be part of this tier, as well as teacher-led classroom strategies. Professional development is going to be needed so that teachers can manage behavior in the classroom, so that teachers know how to use strategies like increasing opportunity to respond, giving behavior-specific praise, using active supervision, giving instructional feedback, pre-correction, and using instructional choice in order to manage some of these behaviors before they escalate. This kind of intervention has been shown to reach about 80% of the student population. From there, based on our screening tools, we will know what students need Tier 2 interventions. We'll be using that an intervention grid, which is something our committee will work on, so that we have kind of a menu of interventions. These could be things such as check-in, check-out, small group support for anger management or goal setting, or social skills, in-class supports, or even things like homework club on an individualized basis for students. Now, this should reach about 10 to 15% of our students, the research has shown. That means we're left with a small population of students that would need a Tier 3 support. These would be behavior intervention plans that are based on functional behavior analysis in conjunction with these Tier 1 and Tier 2 supports as well. Across the board for Tier 1, 2, and 3, there are classroom strategies that we will need to train our teachers to use. Giving teachers the professional development to implement these strategies won't just support our learners who have behavior disorders, but they'll create a positive classroom environment for all students. These strategies include things like grouping and peer tutoring so that we can utilize peer assistance, giving in-class feedback and conferencing, teaching appropriate language and how to comply with teacher directions, the use of redirection and positive reinforcement so that we reduce our reliance on punitive behavior strategies, managing clear classroom boundaries to create a safe environment for all of our students, planning ahead, managing these behaviors before they escalate, and having strategies for how to deal with these behaviors as they occur, and how to recover and maintain the academic focus in our classroom after these disturbances. Along the lines of our interventions, we do have a couple special populations in our district. We have students who have already been identified with ADHD or depression, and it's important that we take specific steps to support them. ADHD, for example, is known to have a strong comorbidity. That means it correlates with other disorders. It leads to significant academic deficits if it's not appropriately addressed. Based on the current research, there are some new strategies for working with ADHD. Some of our teachers may be more accustomed to strategies for reducing the stimulus for these students, but the most current research actually states that these students may be understimulated. So we need to support them through not only positive behavior supports, and training for parents, but we can support them in the classroom by giving opportunities for incidental learning or nonlinear thinking, giving them choices, allowing them to move and take part in hands-on activities, the use of technology to stimulate their learning, and then also teaching problem-solving strategies for them. Students who suffer from depression need other specific supports. The district can provide behavior therapy and family anxiety management training. However, these kinds of interventions can be costly and not always available. So we have to look at classroom strategies so that our teachers are in a position where they can really be an integral part of intervention. Classroom strategies could include the creation of a touchstone teacher, someone who is the primary support contact for these students. All of our teachers can use feedback and goal setting to help support them, teach problem solving, organization skills, and task completion skills, give opportunities for positive social interaction. When working with our students with depression, a team approach and team coaching is going to be important. We need to establish modifications and accommodations so we know how to respond to the fluctuations in mood and fluctuations in classroom behavior that we see with students who have depression. Maintaining home-school communication and feedback is going to be important in working with these students. So how do we put all of this intervention together? Well, this program is going to be a long-term program for intervention and support. Keys to success are going to include the strong Tier 1 support, these universal supports. Really effectively implementing the prevention and the teaching of positive behavior reduces the need for Tier 2 and Tier 3 intervention. We have to have a long-term plan for identification and intervention. We need strong leadership. We need adequate funding in the district. We need clear goals and benchmarks and a way to look at our data on a consistent basis. We need professional development. We need our teachers to become on-site experts, to become resources for one another. We need a professional library with teacher toolkits for learning and implementing these strategies. We also need to understand that there will be some resistance and some setbacks, that a long-term plan like this is going to need teacher buy-in, and that's not always going to be easy. But by showing our teachers that addressing these behaviors in the classroom can lead to greater academic success and a more positive classroom environment for all of our students and our staff, we can have great success in supporting not only students, but our staff as well. Finally, here are some important resources for learning to implement classroom strategies and work with students with behavior disorders. These are all resources used to help put this PowerPoint together, but also resources that can help in implementing this plan. Thank you so much.